Hi, good morning. Thank you for waiting. We just need to put on a slide. Yeah, it is. Good morning, everybody. Welcome to the webinar, Cancer of the Nose, What You Need to Know. This event is co-organized by the NPC Society of Malaysia and Faculty of Dentistry, University of Malaya, and supported by the Cancer Survival Support Group, CSSG, and Society for Cancer Advocacy and Awareness Kuching, SCAN. I am Yap Lifa, the president of the NPC Society of Malaysia, and also the moderator for today's event. Today, we are going to talk about a cancer type called NPC. The full name is nasopharyngeal carcinoma. I think probably the full name is not that easy to pronounce, so many people usually call it nose cancer. NPC is a major health issue in Malaysia. It has been one of the top 5 cancers for the past 20 years. And NPC Society of Malaysia was established in 2010 to support research on NPC and to promote awareness and knowledge on this disease. It is our great honor to have Dr. Liew Yew Toong today to tell us what we need to know about this disease. We will have Q&A session after Dr. Liew's talk. If you have any question, please type into the Q&A box. Today's agenda also includes 2 videos from our supporting partners, which I will introduce more a bit later. So without further ado, let me introduce our speaker. Dr. Liew is an ENT surgeon at the Universiti Malaya Medical Centre. He received his Bachelor of Medicine and Bachelor of Surgery degree from University of Malaya, and later a master degree in head and neck surgery from UM as well. During his master training, he was posted to several hospitals across Malaysia, including Queen Elizabeth Hospital KK Sabah, where he saw a lot of NPC cases. He then came back to UM as a lecturer and was awarded a fellowship in head and neck surgery in Korea. He is also a member of the Royal College of Surgeons, Edinburgh, UK. Apart from clinical work, Dr. Liew is also very active in doing research, and he is a principal investigator of several projects, including a project that characterizes clinical features of NPC patients with different ethnicities in Malaysia. Today, he's going to share with us some basic and yet very important information on NPC. Dr. Liew? The screen is yours.
Okay, a very good morning to everyone here, and it's a very good introduction from kind introduction from Dr. Yap, and I'm very glad that I'm being given the opportunity to speak on this public health topic on NPC. Millions of thanks to NPC Society as well, the CSSG group, and also the SCAN group. Okay, so I'm just going to share my slides here. Okay. I hope everyone can see my slide right here. You'll be able to, I think.
Yes, can see clearly.
Okay, so the public health topic today is on the cancer of the nose. And I'm here to tell whoever present here what you should know and what you all need to know about nose cancer. The focus of this topic is basically what Dr. Yap has mentioned, the nasopharyngeal carcinoma. Nasopharyngeal cancer is a bit difficult to pronounce it, especially for general people. So it's okay, bear with me. I will go bring you around to understand more about this cancer. Again, I'm Dr. Liew. I'm currently practicing ENT surgeon in Universiti Malaya Medical Centre and also the Specialty Centre in the Faculty of Medicine. So, as for nose cancer, general population, the general people will label all sorts of cancerous growth from the human nose as nose cancer. But again, the topic of this public health talk is on nasopharyngeal cancer. Let me guide you and show you where the cancer arises from. For human being nose consists of multiple compartments. This is the diagram. It's a very simple diagram looking from the side, showing a whole nose cavity of human being. As you can see from the side, from this diagram here, the main part, we call it a nasal cavity of the nose proper, is the front part of our nose. The back part of it, the small deep-seated structures, is being called the nasopharynx. Any cancer arises from this area is being called nasopharyngeal cancer. This is a very important structure because it's deep-seated and is closely related to multiple important vital structures in our head and neck region. It's just situated just below our brain, is very close by to the upper part of our backbone, and there's multiple small nerves that come up from the brain. Also, is closely related. Any growth or advancement of the cancer that arises from this nasopharynx can lead to multiple symptoms because of the invasion of the nearby structures. From this diagram, you can see a small opening here. Even this small opening is an opening that leading to our ear. Therefore, any growth over this area, it could obstruct over here, leading to ear symptoms. Even cancer that arises from the nose, but it can lead to the symptoms that happen in the ear. COVID has been a very, very hot topic for the past year or two. Okay, as we all know, to come to the diagnosis of COVID, we need to go through a PCR swab test. If anyone here has experience being swabbed, being done the nasopharyngeal swab, it must be a very, very bad experience because we have to go through about 8 to 9 cm of the nose proper only to reach the nasopharynx because the swab was from because the lining from the nasopharynx. You can imagine how deep-seated this structure is. In other languages for nasopharyngeal cancer, in Mandarin we call it DBNA. In Malay we call it a cancer polypoxidal. It's all being used interchangeably. This is a video in one of my patients. It's a normal video showing a normal pharynx. To examine the nasopharynx, the endoscope, the scope needs to be inserted. As being shown in the video, this scope is being inserted in the right side of our nose. You can see how deep the scope needs to be inserted to examine the whole nasopharynx. Okay, let me stop here a little bit. Okay, this is the video showing a normal nasopharynx on the right side. This is a medial structures. Any cancer that arises from this area, this is the commonest area of the nasopharynx where the cancer arises. When the cancer starts to grow, it can go occupy the full cavity and go to the right side, go to the left side. If it continue to grow up, it will be our brain. If you can appreciate the small opening here and correlate to the diagram that I show you, this is a small opening leading to our ear. So any growth over this area, from this area, leading to the ear symptoms. A very simple introduction again on NPC. Any types of cancer that arises from this area, we call it the nasopharyngeal cancer. It's very remarkably prevalent in our country, especially so predominant among the Chinese population. Over the Borneo side, the East Malaysia, the incidence is also very high in Sabah, Sarawak. This is especially so for one of the very special natives, the Liew natives in Sarawak, is being reported to have even the highest incidence of NPC over the world. Again, the picture showing the right side. I'm just bringing you through so that you can understand how the cancer look like. This is the picture showing the right side of the nasopharynx. If you can imagine, remember back the first few slides, the video I show you, the nasopharynx mucosa was totally flat. This is a patient with a nasopharyngeal cancer with an enlarged mass in the nasopharynx with a lot of dilated vessels. It's a very angry looking mass. He was diagnosed to have NPC from the biopsy. This is the most common features of this NPC because they present as enlarged mass. And not so typical presentation, the cancer can even present as a very flat abnormal outflows over this area. Let's look at data globally. Okay, actually looking at the nasopharynx is actually not so common compared to other types of cancer, breast cancer, lung, colon, stomach, cervix, esophagus, thyroid, etc. This is not even within the first 20 most common cancer over the world. But however, again, I have to emphasize that this is very prevalent, endemic in Malaysia, Asian country, and especially so the Chinese population. This NPC has a very, very interesting geographical distribution. This is not common in African country, European country, and America, but in Asia. In Asia, it has recorded up to 85.2% of the new cases yearly. Looking specifically for Chinese, Malaysian Chinese is ranked the third after China and Singapore Chinese. It's also very interesting. It was about 5 to 10 years ago when Malaysia had started to collect data on NPC. And the data collected was about from 2012 to 2016. As you can see, at that point in time, NPC was fifth most common. In 5 to 10 years time, the data was about 2 years ago, was collected 2 years ago. It has done one step to become the fourth most common. So I have to re-emphasize that don't overlook this disease. This is getting more and more common. Be more vigilant in the signs, symptoms that I'm going to let you know. Okay. The lifetime risk for males is relatively 2 to 3 times more common for males. For Chinese itself, out of 100 people, there is 1 case, 1 new case, and as for Malays, 340 cases. And the lifetime risk for a female is 1 in 480. In a bimodal presentation of this disease, the incidence peak after the age at the age of 25 or after the age of 25. There's a second peak of incidence after the age of 65. About that, we ENT people has faced a lot of challenges in dealing with these kind of diseases. It's not cancer because more than 70% of people that come to us will have their stage 3 and 4. Stage 3 and 4 compared to early stage has a totally different response and the survival rate. They will usually do badly. Because of a very deep-seated structure, this disease usually is detected late rather than early. We have faced huge challenges because they come to us in very late stage. And of course, not to forget about the treatment toxicity that we receive after the treatment. NPC early stage are usually the symptoms of non-specific. So the talk here is to enlighten you all on the early symptoms or the symptoms that all of you need to pay attention to. These factors means the possible factors that can lead to the development of this cancer is actually multifactorial. Means there's multiple factors combined together leading to the development of this cancer. Environmental factors, exposure to wood dust, chemicals, and diet. Diet is extremely important. Chronic long-term, large amount intake of salted fish, salted soybean, or pickled vegetables, you definitely put someone at risk. How much is considered significant? This is very similar if I put smoking habit into the comparison. If someone smoked at a very early age, amount of smoke plus amount of cigarette is more. The long duration of smoking, there will definitely higher risk being imposed to them. Okay, this is the picture showing the pickled fruits, pickled fruit, vegetables, fish. Other environmental factors, of course, we always blame tobacco, alcohol, as one of the culprit cancers, which is very true for this situation. Okay, let's look at this slide. Very, very important risk factor for the development of this cancer is the family history, the genetics. If someone has any family history of cancer, of NPC that run in the family, the first generation family members will have about 15% increase of risk to develop this NPC. And it's very interestingly and it's well proven that one of the virus infection persistent EBV, the virus name is called EBV, is also being considered as one of the culprits to initiate the tumor formation or cancer formation. So one slide just talk on smoking, because it was used not so very close relationship between smoking and NPC, but this is a definite risk factors. For a smoker, they will have 1.3 times higher risk than the non-smoker. The younger they smoke, especially those start to smoke at the age of less than 16 years old, will also have a significant risk for this NPC development. And lastly, amount of more than 16 sticks a day. So the clinical presentation, how they actually present, what are the features that is related to this NPC? This neck swelling is the commonest. It's more common on one side when they start to develop on one side. It's also when the cancer start to develop and start to grow and go to the other side of the nasopharynx, it can present as both neck swelling. It's always painless and the size is always rough. About 60 to 70% of the NPC patients come to us with neck swelling. Okay. Other known symptoms may be some bleeding or some blood stain, nose discharge, mucus or saliva, and if the tumor has grown to a certain size, it will lead to nose block. A lot of people might think, this nose cancer we present is very, very torrential, very severe bleeding. But for NPC, I can tell you this is not. Yes, they might have some blood stain, mucus, nose mucus, and saliva, but usually they don't present with a very frank, very severe bleeding from it. Okay, this is a picture. If you still remember my word that there's a small opening from the nasopharynx that's leading to the ear. This is a very nice diagram. When the tumor starts to grow at the nasopharynx, this orifice or this opening is being blocked by the cancer, and this tube will not function well. When these tubes don't function well, fluid start to accumulate in one side of the ear. If severe, it can present on both sides of the ear as well. So the symptoms that present is usually early symptoms. Remember, ear symptom is always an early symptom. One-sided deafness, echoing, ringing sound, or tinnitus in the ear. Okay, other presentation will be some headache in 20% of them, and of course, just now I mentioned there's multiple small nerves that comes out into the nasopharynx, which is very closely related to that structure. Any increase in size or advancement of the cancer can lead to involvement of the nerve causing a scream. Okay, a sudden onset of the scream, deviation of the tongue, because one of the nerves that control the movement of the tongue can be infiltrated and causing weakness. and of course, facial pain over this area. And cancer, when we talk about cancer, that has the potential and potency to spread to other places of our body. The commonest spread is the bone. Second will be liver, then followed by lung. How to diagnose the NPC? And of course, other than the symptoms, history of presentation is still the most important examination with the endoscope. Okay? This structure is a very, very deep structure. We need the endoscope. And of course, this endoscope is being used by ENT surgeons to examine the nasopharynx to make sure and to examine and to see where is the growth of the lesion. Some very early stage cancer of the nose might not even be seen from the scope. Some other tests, especially the scan, might need to come into play to help to support the diagnosis. But the basic of the diagnosis is from the use of the endoscope. And of course, there are other parameters. If I'm quite sure a lot of people has gone for a usual basic screening from the health screening package from certain hospitals. Some certain blood markers from the blood might indicate, but it's not 100% accurate. They can only indicate and give us a clue, but the come to the basic again, the gold standard still need the sampling of the tissue and the tissue being sent to the lab for confirmation. This is the video of one of my patients with cancer of the nose. So I think I like those on the right side is a tumor. I think I showed this picture before. You can see a very exuberant and angry looking. We took a biopsy from this area and the final lab report showed NPC unluckily. This is how we perform the endoscopic examination in the clinic setting. This is a very, very small scope that we use to insert into the nose cavity of the patient. As you can see from far, the TV screen here show a normal nasal pharynx of this patient. Okay. When we see a growth, we use a metallic forceps to take a biopsy and the tissue later on being sent to the lab for urgent. Okay, right?
Yes, yes, okay.
Okay, so I think it's okay. I'm very sorry for that. So right now, so I mentioned also before, there's some imaging scan which come into play. Of course, the CT scan, MRI, PET scan, just to let you know the images from the CT scan showing a very exuberant mass on the nasopharynx. Same for the MRI images. Okay, so quickly I come to the treatment. For the treatment of NPC, it's not only the ENT. Actually, there are multiple teams being involved in managing a patient with the NPC. Okay, they involve not only ENT, the vet dental has a very important role to be in because they have to make sure the oral hygiene is good before they can proceed for the next step of treatment, which is in which the radiotherapy is a mainstay of treatment. Later on, radiotherapy will be performed and will be helped by our oncologists. So as for NPC treatment, the mainstay of treatment is still the radiotherapy. There are many types of radiotherapy. One of that, proton therapy, also is one of the form of radiotherapy. As you all know, one of our country hero, of a national hero, Datuk Lee Chong Wei, has actually received a proton therapy for that, for his unlucky situation. Okay. So for advanced stage NPC, a lot of the time chemotherapy need to be added on to improve the sensitivity of, and I would say to improve the function of the radiotherapy. And of course, a lot of people here might might hear the immunotherapy before. And usually this kind of immunotherapy is for those advanced cancer which has gone to other place of the body, or the cancer which has come back, or we call it a recurrent cancer. I think one slide to share what is the treatment for recurrent cancer, where the meaning is the cancer of the NPC that has come back after the full treatment. The option is to re-radiotherapy again, and of course re-radiotherapy again will be giving patient a lot of toxicity and side effect. Their quality of life will definitely be poor. And if the cancer is amendable for surgery, then surgery will come into play. So this is the video that's showing the surgery which has come for one of the patient with the cancer of the nose on the left side. This is the video after removal. Okay, if the cancer has been just purely localized in the neck region, a major surgery to remove the cancer is warranted, provided the cancer didn't spread to elsewhere of our body. Chemotherapy, of course, but usually for palliative purposes. Okay, some slide to show how bad the radiotherapy can do to the patients who suffer from NPC. Okay, early complication, they can have all sorts of ulcers that develop in the oral cavity, the tongue. The skin changes, causing all sorts of breakdown of the skin. And of course, when the patient encounter this kind of side effect, then we have very bad pain, dysphagia, altered taste, even vomiting. The chemotherapy effect will usually may lead to the derangement of the blood, causing infection because of the reduction of our white cell, and of course someone might lead to a severe tiredness and even depression. Late complication, it can affect multiple nerves in our body. Then of course the long term, they will be having a xerostomia, which is dried mouth. Anyone having a dried mouth, a reduction in the saliva amount might put them at higher risk to develop the fungal infection we call oral candidiasis. Ear complication, blue ear, a fluid accumulation in the ear, difficulty in opening the mouth, and long-term ear infection too. As for the nose complication, you can see this is the patient that suffered, or I wouldn't say suffered, they completed a whole course of radiotherapy. There's so much of disruption or damage to the lining or the skin within the nose cavity. They will develop so much of crusting. This crusting will lead to infection or even bleeding. And the sinus, a thick pus coming up for all sorts of cavities in our nose cavity. So take home message, very important for you all to recognize early features. To diagnose the NPC, the gold standard still need an endoscope, biopsy. If there's any presence of any suspicious symptoms I have mentioned to you, please refer to us for early endoscopic examination. We hope to catch more and more patients at their early stage. And lastly, early detection will definitely make the difference in terms of survival. So a few suggestions from my team. Okay, for anyone with multiple risk factors, start the screening process. Start to see an ENT surgeon, I would say, from the age of 40 or even earlier if you have more risk factors. I think the risk factors I've mentioned all in details to you. Screening tools, endoscope, examination of the nasopharynx, some lab marker, which I already mentioned as well. So far, there's no fixed guideline for NPC or consensus for NPC. At which age, at what age is to start screening. This is basically from experience, our own suggestions. Okay, if cancer come back, and of course we don't hope
the cancer to come back, because whenever the cancer come back, they usually will not do so well. So what we need to do to prevent them? So first of all, to eliminate all the potential risk factors, stop smoking, tobacco, alcohol intake, and try to avoid preserved food. And of course, please lead a very, very healthy lifestyle. For whoever who have cancer of the NPC being diagnosed, please do not default. Continue the lifelong follow-up with your doctors. This slide is to show the warning sign. Again, I have to reiterate the warning sign. If anyone have any of the symptoms or combination of these symptoms, please refer to an ENT as soon as possible. Again, I have to mention a painless neck lump, some blood stain, nasal discharge, saliva, one-sided hearing loss as early symptoms, persistent headache, face numbness or pain, double vision. Okay, so any combination of these symptoms or any presence of these symptoms persistently for more than 2 weeks, please, right, do not overlook these symptoms. A lot of people will wonder what ENT surgery is actually treating. In a lot of laymen or general population, they might think ENT, they are actually treating some minor diseases of the nose, infection, sinusitis, earwax infection. But we have a very, very nice, good team effort in our hospital. We are dealing with all sorts of cancer. We are trained in dealing with all sorts of cancer. The tongue cancer, especially this tongue cancer, where the collaboration with a dental colleague in managing all sorts of tongue cancer, voice box cancer, salivary gland cancers, and of course, thyroid cancer. If anyone has any questions, any symptoms of this, please do not hesitate to call us and to reach at least an ENT. I think that's all for my slide. Thank you very much.
Hi, thank you, Dr. Liew, for your talk. You may turn on your camera now. Yeah. Thank you very much for your sharing. If anyone has any question, please type it into the Q&A box. Okay, let's see the question. Our first question is, does eating meal while it is still hot will put the person at risk for NPC?
Okay, I would say this is a very, very nice question. But so far, not that we know of that taking extremely hot meal will put someone at risk. But very common sense, if any of our body, if chronically being exposed to a stimulus, I would say it may be a possible cause. So far, they do not have any strong data to support that. And for us, we usually don't advise people to take their meal when the temperature is still very hot. So I know this is taking a meal when this is still hot is actually, especially for Chinese, is a tradition. But common sense tell me that this is not too healthy. So
hot soup is not advisable?
Because it chronically, if you are taking it every day, every single minute, so to say, you damage your mucosa, you damage any lining of our throat, of our tongue. This will lead, if long-term exposure, it may lead to the changes of the DNA. This is, let's say I take another example, the voice box cancer. The voice box cancer. If the voice box cancer, someone is having reflux, long-term reflux coming from the stomach to the voice box, it will lead to long-term inflammation. and this reflects a long-term inflammation in our voice box is actually a risk factor from even a reflux per se to develop into a voice box cancer. So far, as I said, and they don't have strong enough data taking hot meal, whether it will contribute or not. I will state not so advisable if the food is too hot.
Okay, so I guess everything has to be taken in moderation. Like, I guess nobody really have hot soup every meal every day for like a long period of time, right? If like once a week in one meal, shouldn't be too panicking about it. Is it correct to say that?
Yeah, I should say so.
Okay, thank you. And okay, another question is, how soon will you want the dental clearance to be completed? Usually we were given 1 week for clearance, TCA at ENT, and at primary dental care, it is not so achievable.
Okay, for this question, actually, it is not involving us. There's, when something involving many teams, this may be a bit troublesome. But of course, the services from us, our job is to treat the cancer as soon as possible once it is diagnosed. But generally, we send those newly NPC patients for dental clearance. Once it is diagnosed, we need to wait until the wound from the extraction heal. After the wound heal, then only they are eligible for to receive the radiotherapy. So a week or two before starting of the radiotherapy is a common and is also a routine practice for us.
Okay, thank you. We saw some question in the chat box as well. I will read it out. Is proton therapy better than conventional radiotherapy in NPC treatment?
Yeah, proton therapy is a form of radiotherapy also, I would say. It's very difficult to explain in detail how the physics works for proton therapy, but you just take my word, this is a form of radiotherapy, but it is a very, very special type of radiotherapy that is concentrated at the cancer area. For conventional radiotherapy, when the radiotherapy was being shined from one side, there is an exit dose. So the exit dose and the conventional radiotherapy itself will also shine and cover some normal structures surrounding the cancerous region. So once the normal structures is being shined, they will tend to get damaged easily. So the proton therapy is a very, very focused type of radiotherapy so that the exposure of the radiotherapy to the surrounding normal structures is minimized.
The follow-up question is, how many centers for RT and proton therapy in Malaysia?
Not that I know of. I think Sunway Medical Centre has one of it.
Have proton therapy?
If not mistaken, but not that I know of. In Universiti Malaya Medical Centre, the best that we have is not the so conventional radiotherapy, but upgrade of radiotherapy we call the IMRT. This is one step below a proton therapy.
Because I understand that proton therapy, the machine is very, very expensive. So a few years ago, when I talked to the oncologists, they say Malaysia haven't got one yet. A few years ago, hopefully, I'm not sure. So maybe it's worth finding out if it's necessary. Yeah. So another question is related to the diet. Like, is ikan bilis considered salted fish? And I just combine a few questions, like how much consumption of a preserved food is considered significant as a risk factor, like alcohol, how much is considered bad?
For these, especially the preserved food, the exact amount, how much you take. For someone, example, when you're taking a preserved food, one small plate compared to one big bowl, is also very similar to the amount of smoking, I would say. So the more frequent someone take preserved food, the longer duration they take. Especially, let's say, put it in an example, daily intake of the preserved food for prolonged duration, you definitely, it's proven to put someone at risk. And of course, this taking in preserved food will put someone a definite to develop a cancer. No, for this NPC to develop this multifactorial, not only the food, not only the environmental factors, genetics plays a very, very important role in helping, or I wouldn't say helping, in initiating the tumor formation. Okay, so genetic, that's why there are differences in terms of the incidence and prevalence of NPC, in terms of the geographical distribution. It's more towards Chinese. Too bad that we have inherited the gene, but the consumption, the amount of consumption of the preserved food alone may not be only one factor to initiate that. You need a multiple combination of factors who will then put someone at risk to develop that. Okay.
Yeah. So I think there are some publications suggest that when the preserved food do more harm for young kids, young children, if you eat a lot of preserved food when you are very young, the risk was higher than after you adult to eat those kind of food. Yeah.
Yeah,
So
and for those preserved food, because they are actually usually throughout the process, they are not properly being processed until they have accumulated one's very special chemicals. We call it a nitrosamines. This is carcinogenic. It's an agent that can lead to cancer formation. So please be careful of this food intake.
Thank you. And just now you mentioned that it is multifactorial. So genetic is one of them.
Yeah.
Right? So if I had like family members had NPC, does it mean that I am at the higher risk of develop NPC as well?
Yeah, this is for sure, because genetics, the inheritance play a very, very important role. In general, we will say 10 to 15% increase in risk. It's not a must someone will develop it, especially the first generation family members. For someone who had the history of NPC in the family, we will take it at 10 to 15%. Still, there's a lot of interaction between the genetic abnormality or genetic changes and the other factors that I have mentioned.
Okay, so can you give those people some suggestion or advice? What should they do if the family member have NPC?
I would say seek ENT consultation for earlier endoscopic examination, at least a yearly. If you find the first visit there's nothing conclusive, hopefully you don't find anything, then best is to follow up once a year with the endoscopic examination. And of course, self-awareness for this kind of relative related to the NPC patients. Please be aware of any symptoms that I have mentioned, those important features. Any kind of symptoms persistently present for 2 weeks, do not hesitate. Come early to us. Okay?
Okay. So just don't ignore those symptoms because sometimes it can be unspecific, like you got blood in the nose, so sometimes it tends to ignore it. So yeah, I think it's a very important point that people understand that.
Yeah, especially those, you see, we start to have a small growth in the nasopharynx. They may have just excessive extra mucus than usual. But a lot of people might take it as nothing, just treat it a normal flu. But again, persistent symptoms for more than 2 weeks, don't overlook it. Come to us to be more sure.
Okay, thank you. And there's one question that asks about sensitive nose, because I think there are many people have the nose are very sensitive, like to aircon. Is it for how long for nose sensitive may cause cancer?
I don't think so. I don't think so. I don't think this is a risk factors, especially exposure to aircon that leading to cancer formation. I'm not sure. I'm not sure. I don't think so. I don't think so.
Okay, I think it's a big relief for many people.
Yeah.
Okay, another is from a NPC survival. Is that how many years do you think it is considered safe from recurrence of NPC?
Despite so much of advancement in medicine, right, no one dare to say someone is cured until 5 years follow-up without cancer coming back. Okay, we will stick to 5 years. By 5 years, you are cured from that cancer. You are cured from the cancer. We still take it up to 5 years. But you still need to have a lifelong follow-up. Maybe not so frequent.
Okay. Okay, and then another one is about environment risk factor. How about the smoke from jaw stick that is used during prayer? Is it a risk factor?
Very good question. Again, I'm not too sure about joystick, but I would say chronic, still a smoke. But of course, the contents compared to the cigarette smoking is also different. I don't think there's any evidence support that the joystick that can lead to that. But so far, yes, I think something worth to explore more on that. Thanks for your suggestion.
I guess it's quite difficult to design a study to get a very strong answer for that, because we need to measure how much smoke that the person exposed to and how frequent. I think for the joystick, smoke from joystick is quite a challenging, quite a tricky study to design. Yeah. And we have another one is undifferentiated and differentiated subtypes of non-characterizing NPC have no prognostic significance. Do you agree on this statement? Any explanation for this behavior?
No. So there's a definite difference between both subtypes. Okay. Oh, where's the question again?
Yeah.
Okay, the undifferentiated and the differentiated. Okay, there are big difference. That's why the WHO has classified it differently, because both of them has carried different prognostic significance. For a differentiated cancer, the response to a radiotherapy, the responsiveness to radiotherapy and chemotherapy is not as good compared to undifferentiated cancer. Those undifferentiated cancer will respond better, but the bad side for undifferentiated cancer is because undifferentiated, they're relatively more aggressive. When they're more aggressive, they have more tendency to spread to elsewhere of the body. Yes, one side is they respond better towards the radiotherapy and the chemotherapy, but if they're being detected early and receive treatment early, we have definitely reduced the chances of the distant spread of this type of cancer. This has both different significance.
Okay. Another question is, since Korea have many preserved food, so is Korean will have more risk to develop NPC?
Somehow in Korea, for Korea, there's actually not many NPC developing there, or especially the new cases. Maybe I would say I myself is thinking whether, especially the preserved food kimchi, will kimchi actually has any protective effect for NPC? Again, there's no study on that. Also, something to look forward for further exploration, the studies on this area. But truly, Korean side, there are not many. The incident there is not high. The incidence is on.
Maybe also is, as you say earlier, is multifactorial, is it?
Yeah.
Maybe involve genetic, and maybe the environmental actually environment is different.
Yeah.
So yeah. And the risk factor, you also mentioned about EBV infection. Because it's a virus. Is there a way to prevent it to be infected by EBV?
It's actually very, very difficult to prevent EBV infection. A lot, I would say more than 90% of the population is already infected by EBV. Where after the infection of EBV, 95% of them will recover, but the EBV infection will stay in the body as an inactive agent. And of course, anytime they can reactivate. I mentioned in my slide before the very complex interaction between the genetic environmental factors and the EBV infection. If someone has multiple risk factors and so unlucky that the EBV reactivate, then definitely this EBV may initiate the tumor formation. The transmission of EBV is by saliva or body fluid, such as kissing, sharing of the utensil tools. Most of the people is actually already infected by EBV, and so far there's no vaccination for the EBV. I would say in general, EBV is not dangerous. I would say COVID is more dangerous right now.
Yeah, for now, hopefully. Okay, thank you very much.
Okay. No
I think we have answered all the questions. And so in the chat box, you can find a link to the feedback form that you can fill in anytime that you want, and an e-certificate will be sent to you after you fill in the form. So now we need to move on to our next agenda. We will play 2 videos from our supporting partners. One is the introduction of CSSG by Mr. Jim Kao, and the other one is a very beautiful song by Alina Murang in collaboration with SCAN to highlight this year's World Cancer Day's theme, Close the Care Gap.
Hello, I'm Jim Kao. I am an NPC survivor since 2005. Thank you for inviting me to introduce our Cancer Survivor Support Group, or CSSG in short. Our group, which was formed 10 years ago in November 2011 by my wife and I, together with a few cancer survivor friends. We are actually a small voluntary support group of about 50 members currently. Most of us in the group are NPC survivors. We usually meet in my house in USJ, but has since gone virtual in 2020. We have provided assistance and care to about 200 cancer patients and caregivers, not only in the Klang Valley, but also outstation patients and even patients from as far as Los Angeles, United States. Learning from our experience, we understand and believe the importance of peer support for patients and also their caregivers. We like to encourage all patients to seek peer support early from the time of their diagnosis. Patients need to understand their whole treatment process before treatment. They need to prepare themselves well in order to reduce the risk of complication and better manage their side effects. Understanding and better preparation will reduce their fear level and give them the confidence and knowing that they are not alone in their battle. For NPC patients, we will discuss the possible side effects from the radiotherapy and chemotherapy, and we will guide them to manage it. We will emphasize the importance of good oral hygiene to avoid fungus growth and ulcer in the mouth. We will teach them to exercise the salivary gland, jaw, and neck. We will not only recommend their diet, but we emphasize the importance of eating well and train their brains to accept the food, as it is usually a cycle problem. Post-treatment, we will discuss their new diet plan, lifestyle changes needed, short and long-term side effects, the limited treatment options for recurrent cases, which we hope new NPC research will help in this area. We would like to encourage every NPC patient to join a NPC support group of their choice. Our group, with experience and knowledge, is confident that the support we provide will assist NPC patients to navigate their treatment journey better and to have a better life after cancer. Thank you for your attention.
Thank you. I hope that you have found the videos useful and hope that our cancer care system in Malaysia will be improved soon. And before I end today's event, I would like to thank Dr. Liew for his sharing and CSSG and SCAN for their support. And last but not least, a big thank to the co-organizer, the RMU team in Faculty of Dentistry, University of Malaya. Thank you for your participation, and we hope to see you again in our future events. Thank you. Goodbye.
Thank you.
We have 6 minutes.